Welcome to Wellness Health Services Health Talks. Today we are going to be talking about gestational hypertension. This is an important condition because it affects a significant number of expectant mothers, and usually it has serious implications. In this discussion, we are going to look at what causes gestational hypertension, who is at risk, what are the complications associated with it, and how do we prevent it. So we are privileged to have one of our long-term serving obstetrician and gynecology, and he will introduce himself.
Thank you so much, Dr. Joshua Deritu. I'm glad to be here. My name is Dr. Duncan Madeka, consultant obstetrician and gynecologist in this town of Machakos. It will be a pleasure to talk about gestational hypertension today.
Thank you very much, Daktari. Possibly as so that people get to understand you, get to understand your work, you can give an introduction of what you do as an obstetrician and what is the extent of your encounter with this gestational hypertension.
Thank you. As an obstetrician and gynecologist, my work is basically taking care of women who want to conceive, who want to get babies, and taking them through pregnancy, whether it's a high risk or a normal pregnancy, and even after conduct delivery, and also take care of them after delivery, and any other issue that is associated with reproduction, both for the male and for the female.
Okay, thank you very much, Dr. Madeka. Now, going to our topic of the day, gestational hypertension is one of the conditions that is affecting almost like 10% of all ladies who get expectant, and it is known to cause life for the mother and for the baby. So tell us what is this gestational hypertension, and what causes it, and what are the risks involved in it?
Okay. So to properly talk about gestational hypertension, I will talk about even chronic hypertension. There are many types of hypertension. Hypertension is basically high blood pressure that is above 140/90. And there are different categories, and one of them is called chronic hypertension. Chronic hypertension is when the blood pressure is high even before you conceive. We call that pre-pregnancy hypertension. Or blood pressure that is high before 20 weeks of gestation. So when blood pressure is above 140/90, either before pregnancy or before 20 weeks of that pregnancy, we call it chronic hypertension. Chronic hypertension, it's good to start care early and see your doctor as early as possible, so that you continue on medications that are safe in pregnancy, such as labetalol, methyl dopa, or nifedipine. So it's good to avoid drugs like enalapril, losartan, which can affect the baby. The other thing that we usually do for chronic hypertension, we also usually start the patients on calcium supplements and vitamin D supplements, as well as junior aspirin. So it's very important to seek health care early. The second classification on this chronic hypertension, sometimes even after taking all these measures to prevent severe features, you can get something we call preeclampsia superimposed on chronic hypertension, meaning that you've taken all precautions, but you still get some severe features. Severe features such as you can have proteins in urine, you can start having severe headaches, and very high blood pressures is still above 140/90, even besides taking medication. So the treatment for that one is usually different for chronic hypertension. Now let's switch gears to gestational hypertension. Gestational hypertension previously was called pregnancy-induced hypertension, but we have now moved to gestational hypertension. This is high blood pressure that starts from after 20 weeks of pregnancy. So you can see it's not below 20 weeks, it's after 20 weeks of pregnancy. And we can have that gestational hypertension with something we call preeclampsia. Preeclampsia is when you start getting proteins in urine and also very high blood pressures of above 160/110. Systolic of 160 and diastolic of 110. And this preeclampsia can also have either with severe features or without severe features. These severe features that we are talking about are things like a new onset headache, very severe headache that even if you take painkillers like Panadol, it's not going away. You can also have blurred vision, whereby you cannot see clearly. Then the other thing, you can have very severe abdominal pains. We call them right upper quadrant pains. Other features would be possibly you have something called pulmonary edema, whereby you have fluid in the lungs. And it can also affect other structures, such as the kidneys. When you do the kidney function test, you'll find the creatinine is going up. It can also affect the liver. When you do the liver function test, there are those transaminases. You'll find that they are more than 2 times than the normal. And it can also worsen and lead to conversions, something we call eclampsia. Eclampsia is one of the things any gynecologist or obstetrician is afraid of. These are conversions whereby the mother is conversing or has some fits during pregnancy. And for these are usually because of very high blood pressures, and which have affected different organs. For instance, they could affect the brain and cause some edema or some ischemia, or it could be because of vasoconstriction. So basically, that is the overall picture of this spectrum of, we call them hypertensive disorders of pregnancy, all the way from chronic hypertension to chronic hypertension with superimposed preeclampsia, to gestational hypertension, which can worsen and cause preeclampsia, either without severe features or with severe features, or eclampsia. Then now, what causes this gestational hypertension? Most of the time is because of placental issues. The placenta is the main cause for gestational hypertension, whereby the remodeling of, we call them spiral arteries of the placenta, do not happen in the right way. And this often happens before 20 weeks. That's why it happens after 20 weeks. And who is at risk of this? Sometimes it's not possible to predict, but most of the time it could be the first pregnancy. Someone who is having the first pregnancy. So we call them primigravida or nulliparous. The other risk factor is increased age, advance in age. Those above 35 years could be at a higher risk than those who are below 35 years. Some lifestyle conditions, for instance, someone who is obese, has a BMI of above 30, he has a higher risk. Others include family history of hypertension, or even previous history of high blood pressure in previous pregnancies. Those also with multiple pregnancies, possibly someone with twins or triplets, is also at higher risk of getting this gestational hypertension. Then lastly, some medical conditions. Someone with chronic hypertension, as we said, diabetes, kidney problems, autoimmune disorders, those ones are also at a high risk of this gestational hypertension.
Thank you very much, Dr. Madeka. You have really shed light on what is gestational hypertension. As a family physician, to the general public, my main message would be that you can see that this is a preventable condition, and this is something that can be foreseen even before it comes in. So my encouragement to our viewers is that if you really want to, you are expecting a pregnancy, then it is good to start preparing early. Have your blood pressure checked, make sure that your BMI is optimized to the normal ages. If you have diabetes or you have hypertension, make sure that these conditions are well controlled, and this will decrease your risk of having this life-threatening condition when you get expectant. So that is what I would want to stress as a family physician. So going back to Dr. Madeka, tell us, how do you know that someone is having gestational hypertension? How do the patient present, and how can we tell that this is gestational hypertension?
Okay, so for gestational hypertension, even before coming to the clinical presentation, The most important, as Dr. Nderitu said, start your clinics early and monitor your blood pressure. Because by the time you're having symptoms, it will be slightly late. But if you start the clinic, antenatal clinic early and monitor the blood pressures early, we can start treatment. But some of the symptoms that these patients may have, one is the elevated blood pressure. So you must monitor the blood pressure for you to know whether it's high or not. When it's above 140 systolic and 90 diastolic, we need to start treatment. Here, it's not like when you are not pregnant, whereby we'll say, we'll monitor the blood pressure for some time, but in pregnancy we start treatment as we continue monitoring the blood pressure, because it has dire consequences to the mother and to the unborn fetus. The second presentation will be things like headache that is not responding to painkillers, things like visual disturbance, you cannot see clearly, you have a lot of abdominal pains, epigastric, just the upper abdomen pains. Then if you do some lab tests such as urinalysis, you may find proteins in urine. Then the other one would be body swelling. You could have just swelling on the face, on the hands, you have edema on the body. And we talked about really how to diagnose it. It's basically blood pressure that is high after 20 weeks of pregnancy. The other way to diagnose it, we said presence of proteins in urine, and also abnormal liver function test, whereby you do LFTs and you find that the transaminases are more than twice the normal range, as well as kidneys could be also be affected. So you can see it's a condition that affects different organs of the body. We also, besides assessing the mother, we also usually do an ultrasound to see how the baby is doing, because this condition, as we'll see, has consequences also to the unborn baby. So those are some of the presentations that these mothers may have, but importantly is to start clinically and monitor the blood pressures early.
Okay, thank you very much, Dr. Madeka. We appreciate now how these patients present to the health providers who are seeing these patients. Remember that doing the blood pressure is the critical component of this disease. And as I always say, is that hypertension is a silent killer. Nobody will know the symptoms. And even when the symptoms present, these are advanced stages of this disease. So it's always good to have your blood pressure checked, and also your blood not only checked but checked appropriately. So Dr. Madeka, when we diagnose that this lady has gestational hypertension, what is the way forward?
Okay.
Yeah, what do we do about treatment?
Okay, so once we diagnose, of course, we, after taking good history and also very good examination, the management, one of the key management depends on the exact hypertension. We have talked about chronic hypertension. Chronic hypertension that is either before pregnancy or before 20 weeks of gestation. So for this one, we need to control the blood pressure. For controlling blood pressure, we use antihypertensives, and we mentioned that we can use drugs like labetalol, the methyl dopa, nifedipine, and the ones that are not controlled, even besides this, we can even add hydralazine. So avoid drugs like the SEI inhibitors and things like losartan and enalapril. They have effects on the baby. Then besides controlling the blood pressure, we start on drugs like junior aspirin. In our setting, initially we were using 75 milligrams, but we have moved to 150 milligrams once a day. You use junior aspirin until delivery. The other is use of vitamin D, which most of the time comes with calcium. This also helps to prevent the onset of the blood pressure, and also in case it comes, it prevents also the severe features. So the second one, besides the medications, in case a mother comes with now preeclampsia with severe features. Severe features, we mentioned things like very severe headache, or they could be having pulmonary edema, they could be having blood vision, they could be having severe abdominal right upper quadrant pains. They could be having what we call HELP syndrome. HELP syndrome is whereby the liver function tests are high. There are features of, we call it hemolysis. The kidney function tests are also high. So for that one, or those who come in eclampsia, we usually recommend we give them magnesium sulfate. Magnesium sulfate is a drug which prevents convulsions. Magnesium sulfate does not manage the blood pressure. It only prevents the conversions. Yes, so that's basically how we manage in terms of the medication. But importantly, it's good to think about when to deliver, because as we said, the cause for this gestational hypertension is issues to do with the placenta. So this condition, it's a progressive condition, meaning that as the gestation increases, it's possible the symptoms will also worsen. So delivery is the ultimate solution. So we buy time as we look forward to delivery. Delivery also depends on the condition and how severe it is. If it's not severe, we aim for delivery at 37 weeks. But if there are severe features, like if someone has eclampsia, or if someone has HELP syndrome, or preeclampsia with these severe features, we may have to deliver early. But before delivery, we assess the mother and also the fetus. For the fetus, we possibly assess by doing an ultrasound to see the weight of the fetus, to see the heart rate of the fetus, and whether there are any other issues with the fetus. I also assess the condition of the mother, because that one will determine, do you want to deliver immediately, or do you want to buy some more time for the fetus to gain some more weight. And that also will also help you to determine whether do you deliver by cesarean section, or do you deliver by normal delivery, which is spontaneous, vertex, or vaginal delivery. Then we also have to talk about the effect of this condition on the mother and on the fetus, because it's very, very important. For the mother, if this condition is not well managed, it can lead to complications. As we saw, it affects many organs. So it can affect the kidneys. Someone can get acute kidney injury, and in even severe cases may need dialysis. A second organ, it can affect the brain, and someone can get a stroke because of this condition. It can also lead to eclampsia, the conversions that we talked about. Because of a conversion, someone can get aspiration pneumonia, difficulty in breathing, and you can even get maternal death because of this condition. So it can affect the mother. It can also affect the fetus. Because of the high blood pressures, this can lead to the severe features that we talked, and lead to premature delivery, whereby you have a preterm delivery. A preterm delivery is where the baby is born possibly before 36 weeks, and they may have low birth weight, and with low birth weight, the baby may have even many other conditions that may affect the survival of that baby. So besides the low birth weight, we can also have something we call fetal growth restriction. Because of the high blood pressure, the baby may not be gaining weight properly during the pregnancy. So we usually do ultrasounds routinely just to see whether that baby is gaining weight well. So it can lead to fetal growth restriction. It can also lead to something we call placenta abruptio. Placenta abruptio is whereby the placenta separates from the wall of the uterus. And if the placenta separates, this one will affect the nutrition of the baby, and you may lose the baby inside the uterus. And also the mother can bleed and can have a very heavy bleeding, which can also affect or lead to a loss of life of that mother. As we said, it can also lead to loss of the fetus even within the uterus. So you can see it's a condition that can affect the life of the mother, and it can affect the life of that baby.
Thank you very much, Dr. Madeka. One of the mnemonics that helps me to remember which drugs to use for hypertension is in pregnancy is healthy mothers love nifedipine. So I know hydralazine, methyl-dopa, labetalol, and nifedipine.
Nice one, nice one.
So that is how I remember that. So as we have talked, this is a life-threatening condition. Everybody has a role from the mother to the healthcare system. So possibly, Dr. Ali, you can help us understand what are the ways that what we can do to prevent these diseases, going from the mother as an individual, as communities, and even the healthcare system. What we need to put in place to avoid and prevent these uncalled for maternal deaths and also loss of the baby.
Okay. So for prevention of the gestational hypertension and the complications that come with it, one, we need to ensure our mothers attend prenatal care and antenatal care. They should even start clinics even before they conceive. It does not happen most of the time in our setting. Most of the mothers come when they are 3 months or even 4 months, but it's good to start clinic even before you conceive. Then once you conceive, start clinic early. Don't say, I am an experienced mother, I will only come to deliver, or I'll come at 6 months. Things can change. And by attending clinic, you will be able to have your blood pressure taken every month. And in case of anything that's happening, interventions can be started early. So to the mothers out there, just start clinic early. Even if it's just checking that blood pressure, it will help to prevent these complications. For those with pre-existing conditions such as chronic hypertension, that's high blood pressure, or diabetes, it needs to be controlled even before you conceive. And by starting clinic early, we will put you on the right treatment, either to prevent the medication, the high blood pressure from worsening, and also to prevent the severe features. Yes, for those with the obesity, exercise is very important, and ensure the BMI is within the normal range even before you conceive, because obesity on its own will even bring the high blood pressure, and also will bring other complications during pregnancy.
Yeah, thank you very much. As a family physician, I will always talk about let's manage our lifestyle, taking a balanced diet, having regular exercises, and making sure that we optimize on our weight through the various ways that we have talked in our previous videos. So, gestational hypertension is a common occurrence. There are risk factors that are associated with this, and it has led to maternal death. And the good news is that these are things that can be prevented, going all the way from seeking health care advice before you conceive, managing your weight, starting an exercise program, maintaining a healthy diet, and also now starting your clinic and seeing your obstetrician on time to prevent the complications that Dr. Madeka has talked about. And also for those who have gotten the gestational hypertension, having the disease managed appropriately. This will give the mother a good outcome, prevent the mother from getting the complications like what we have had, getting convulsions, getting a stroke, having kidney failure, which can lead to complications of dialysis, and also delivering premature babies who are at high risk of death because of the various complications. So thank you very much for watching. I encourage you to subscribe to our channel for more informed content. Let's also share this information within our circles so that all of us join hands to make our society healthier. Thank you for watching. Thank you, Dr. Madeka. Thank you for being with us.
Thank you very much for having me. It was a pleasure. Thank you.